As we age, many of us experience a variety of changes in our sleep patterns. It's completely normal for sleep to shift as we get older, but one of the most common and frustrating issues that older adults often face is waking up in the middle of the night, particularly around 3 a.m. This can lead to feelings of frustration, restlessness, and sometimes even worry, as you find yourself unable to fall back asleep. Waking up at 3 a.m. may seem like a small issue, but it can have a bigger impact on your overall health and well-being than you might think. Sleep is crucial for maintaining good health, and when our sleep patterns are disrupted, it can affect many aspects of our physical and mental health. From weakened immune systems to increased stress levels, poor sleep can make it harder to maintain an active and healthy lifestyle. That's why it's important to understand what might be causing these disturbances, especially if it's a regular occurrence. In this video, we'll explore why waking up at 3 a.m. is so common among older adults and dive into the possible reasons behind this sleep issue. Understanding the root causes of waking up in the middle of the night is the first step in addressing the problem and improving your sleep quality. We'll also discuss what it could mean for your overall health and how sleep disruptions can impact your daily life, energy levels, and cognitive function. We will cover the various factors that contribute to this sleep disruption, such as changes in your body's internal sleep-wake cycle, commonly known as the circadian rhythm. As we age, this natural rhythm often shifts, and it can lead to earlier waking times, typically between 3 and 4 a.m. We'll also touch on how the reduction in melatonin production as we get older affects our ability to stay asleep, and the common physical conditions like sleep apnea or arthritis that might be making your nighttime rest less than optimal. Additionally, we will discuss the role of lifestyle and emotional factors. Stress, anxiety, and depression are common in older adults and can significantly affect sleep quality, sometimes causing you to wake up in the middle of the night and making it difficult to get back to sleep. Other factors such as diet, hydration, and medication use can also play a big part in causing sleep disturbances. Finally, we'll offer practical tips and strategies to help you sleep better and avoid waking up in the middle of the night. From establishing a consistent bedtime routine to improving your sleep environment, we will explore actionable steps you can take to help your body relax and stay asleep throughout the night. By implementing these tips and understanding the underlying causes, you can significantly improve the quality of your sleep, leading to better health and a more energized and fulfilling daily life. So let's dive deeper into why waking up at 3 a.m. is such a common issue for many older adults, and how we can work together to make changes that lead to better sleep and a healthier lifestyle overall. First, it's important to recognize that as we age, our bodies undergo a variety of changes that can have a significant impact on our sleep cycle. One of the most notable changes is the disruption of the circadian rhythm, which is essentially your body's internal clock. This circadian rhythm is responsible for regulating many essential bodily functions, including your sleep-wake cycle. It tells your body when to feel sleepy and when to wake up, helping you maintain a regular sleep pattern. However, as we get older, this rhythm tends to shift and may not align with the sleep patterns we were accustomed to during our younger years. For many older adults, this shift in the circadian rhythm can result in earlier waking times, often around 3 a.m., which can be frustrating and disruptive to your overall rest. The internal clock of older adults may naturally move toward a pattern where the body is primed to wake up earlier than it did in the past, making it harder to stay asleep through the night. This is a common phenomenon, and it's often referred to as advanced sleep phase disorder, where the timing of sleep becomes earlier and earlier. In addition to waking up earlier, some people may also experience a tendency to feel sleepy earlier in the evening, further throwing off their ability to maintain a full night of rest. The shift in your circadian rhythm can also affect your overall sleep quality. As the internal clock changes, it may cause disruptions in the deeper stages of sleep, leading to more light or fragmented sleep throughout the night. This is why many older adults find themselves waking up at odd hours like 3 a.m. or feeling restless at night. These changes can be particularly frustrating for individuals who once had a regular and uninterrupted sleep schedule. While these shifts are a natural part of aging, it's important to be aware of their potential impact on sleep patterns and overall health. This alteration in the circadian rhythm can also make it harder to regulate your body's natural production of melatonin, the hormone responsible for helping you fall and stay asleep. As we age, our bodies tend to produce less melatonin, and this decrease can make it more challenging to maintain restful sleep throughout the night. So, it's no surprise that waking up at 3 a.m. may be a symptom of a disrupted circadian rhythm and reduced melatonin levels. Understanding these natural changes in the body's internal processes can help you better manage your sleep and explore ways to improve it. By recognizing that these changes are part of the aging process, you can take proactive steps to address the shift in your circadian rhythm and find ways to restore a more balanced sleep cycle. Additionally, as we age, our bodies undergo a variety of physiological changes, and one of the most significant changes involves the production of melatonin, the hormone that plays a critical role in regulating sleep. Melatonin is responsible for signaling to your body that it's time to sleep and helps you maintain a consistent sleep cycle. However, as we grow older, the natural production of melatonin gradually decreases. This decrease in melatonin levels can have a profound impact on your ability to fall asleep initially and stay asleep throughout the night. Lower levels of melatonin can make it more challenging to enter the deeper stages of sleep, causing lighter and more fragmented sleep patterns. This means that even if you do manage to fall asleep, you might find yourself waking up more frequently during the night. One of the most common experiences for older adults with lower melatonin production is waking up in the middle of the night, often at around 3 a.m., and struggling to fall back asleep. This interruption in your sleep cycle can leave you feeling restless, frustrated, and fatigued the next day. Furthermore, the decline in melatonin doesn't only affect how well you sleep, but also the overall quality of your rest. Without sufficient melatonin, your body might not transition as smoothly into the restorative phases of sleep, such as deep sleep and REM sleep, both of which are essential for physical and mental rejuvenation. As a result, you might experience more shallow sleep, leading to a sense of grogginess and reduced energy levels upon waking. This drop in melatonin is particularly noticeable in older adults, as the natural production of the hormone continues to decrease with age. The aging process not only affects the body's ability to produce melatonin, but also reduces its sensitivity to the hormone. As a result, even if melatonin is present, it might not be as effective in promoting restful sleep. This can lead to a cycle of disrupted sleep that becomes harder to break over time. The lack of melatonin can also influence your body's ability to regulate other aspects of your circadian rhythm. Since melatonin plays a central role in managing your sleep-wake cycle, a drop in its production can cause shifts in the timing of your sleep patterns. For many older adults, this results in waking up earlier than desired, making it harder to enjoy a full night of uninterrupted sleep. It's essential to understand that this decrease in melatonin is a normal part of the aging process. But it doesn't mean that you are helpless in improving your sleep quality. By recognizing the connection between melatonin and sleep, you can take steps to manage its decline, such as establishing a relaxing bedtime routine, reducing exposure to artificial light in the evening, and exploring melatonin supplements under the guidance of a healthcare professional. Another possible reason for waking up at 3 a.m. could be related to underlying physical health issues, which are more common as we age. There are several conditions that can significantly disrupt sleep, and these disruptions often cause individuals to wake up at specific times during the night, sometimes consistently at 3 a.m. One of the most prevalent sleep disorders among older adults is sleep apnea, a condition where the airway becomes partially or completely obstructed during sleep, leading to brief pauses in breathing. These interruptions can cause you to wake up multiple times throughout the night, often gasping for air, and can make it extremely difficult to stay asleep. Because sleep apnea commonly occurs in episodes, many individuals with this condition find themselves waking up at the same time each night, sometimes around 3 a.m., feeling exhausted and unrested. Another condition that can lead to waking up at 3 a.m. is restless leg syndrome, RLS. RLS is a neurological disorder that causes uncomfortable sensations in the legs, such as itching, crawling, or an irresistible urge to move the legs, particularly when you are resting. This sensation can make it nearly impossible to stay still, especially at night, and it often leads to frequent awakenings. Many individuals with RLS experience their symptoms at night, which can cause them to wake up at regular intervals, including around 3 a.m. This constant disruption of sleep can lead to significant fatigue during the day and can also affect the quality of life over time. Chronic pain is another major factor that can lead to waking up at 3 a.m. As we age, many people develop chronic conditions like arthritis, back pain, or other musculoskeletal issues, which can make it difficult to find a comfortable sleeping position. This pain may worsen during the night, causing frequent awakenings. If the pain becomes severe or more intense, it may force you to wake up at the same time each night, including around 3 a.m. Not only does this prevent restful sleep, but it can also increase stress and anxiety, making it even more challenging to fall back asleep once awakened. In addition to these conditions, bladder issues such as increased nighttime urination, nocturia, are also common among older adults and can contribute to waking up during the night. The need to get up multiple times to use the bathroom, especially if you're dealing with an enlarged prostate or other urinary problems, can lead to waking up at inconvenient times, including 3 a.m. This can interrupt the natural sleep cycle and lead to feeling fatigued and groggy the following morning. If you find yourself consistently waking up at the same time each night, such as 3 a.m., and suspect that any of these physical health conditions might be contributing to the disruption, it's crucial to consult with your healthcare provider. Proper diagnosis and treatment of sleep disorders, chronic pain, or other underlying health conditions can significantly improve your quality of sleep and overall well-being. Your doctor can recommend appropriate treatments, medications, or lifestyle changes that can help alleviate these issues, allowing you to enjoy more restful and uninterrupted sleep. It's also important to be mindful of your lifestyle choices, such as managing stress levels, maintaining a consistent sleep routine, and avoiding stimulating activities close to bedtime. While addressing physical health concerns is vital, these habits can help support a more restful night's sleep and reduce the frequency of waking up in the middle of the night. Stress, anxiety, and depression can significantly impact sleep quality, and they are common contributors to waking up in the middle of the night, especially for older adults. As we age, life changes such as retirement, loss of loved ones, health issues, or concerns about aging can lead to increased stress levels. When stress is left unmanaged, it can cause an overactive mind, making it difficult to relax and fall into a restful sleep. Stressful thoughts can be persistent and disruptive, particularly at night when there are fewer distractions. The constant rumination on worries, such as finances, family, or health concerns, can lead to restless sleep, often resulting in waking up around 3 a.m. and finding it hard to return to sleep. Anxiety is another major factor that affects sleep. Anxiety disorders are common among older adults, and they can manifest as a constant sense of worry or nervousness. This heightened state of alertness can prevent the body from fully relaxing during sleep. The increased levels of adrenaline and cortisol, the body's stress hormones, can cause your body to remain in a heightened state even while trying to rest. This can lead to frequent waking during the night, as well as trouble falling back asleep once you've woken up. Anxiety can also cause physical symptoms, such as muscle tension, rapid heartbeat, or shallow breathing, which can be uncomfortable and prevent you from staying asleep. Depression is another mental health condition that can interfere with sleep patterns. It is not uncommon for older adults to experience symptoms of depression due to factors such as isolation, loss, or chronic health conditions. Depression often causes a range of sleep disturbances, including waking up in the middle of the night, or waking up far too early in the morning and being unable to fall back asleep. People who are depressed may also experience feelings of hopelessness or sadness, which can make it even more challenging to unwind and relax before bed. These negative emotions can keep the mind occupied, leading to difficulty falling or staying asleep. If you are experiencing heightened stress, anxiety, or symptoms of depression, it's important to seek professional support. Mental health conditions can have a significant impact on sleep, and addressing the root causes can help improve both your emotional well-being and your sleep quality. A mental health professional, such as a therapist or counselor, can help you identify the underlying causes of your stress or anxiety and provide coping mechanisms, relaxation techniques, or cognitive behavioral strategies that can help you manage these feelings more effectively. In some cases, medication prescribed by a doctor may also be helpful for managing symptoms of anxiety or depression, contributing to better sleep. It's also important to practice self-care strategies to manage stress and improve your mental health. Regular physical activity, such as walking, yoga, or stretching, can help reduce stress levels and improve sleep. Additionally, practicing mindfulness or relaxation techniques such as deep breathing, meditation, or progressive muscle relaxation can calm the mind and promote better sleep. Ensuring that you have a consistent sleep routine, avoiding stimulants such as caffeine in the afternoon, and creating a relaxing bedtime ritual can also make a big difference in your ability to fall asleep and stay asleep. In conclusion, while stress, anxiety, and depression are common contributors to waking up in the middle of the night, seeking help from a healthcare professional can help you address these issues. By managing your mental health, you can improve your sleep quality and enjoy more restful, uninterrupted nights. Another important factor to consider when discussing why older adults may wake up at 3 a.m. is the impact of medications. As we age, it's common for individuals to be prescribed a variety of medications to manage chronic health conditions, such as high blood pressure, diabetes, arthritis, or heart disease. However, certain medications can interfere with the natural sleep cycle and disrupt the quality of sleep, causing you to wake up during the night, including at a specific time like 3 a.m. Medications such as stimulants, antidepressants, corticosteroids, and certain antihistamines can have side effects that affect sleep. Stimulants, for example, which are often used to treat conditions like ADHD or narcolepsy, can increase alertness and make it difficult for the body to relax and fall asleep. Similarly, certain medications used to treat depression, such as selective serotonin reuptake inhibitors, SSRIs, may cause insomnia or restless sleep. Medications that are meant to address allergies or cold symptoms, such as antihistamines, can also have sedative effects that may alter sleep patterns, leading to waking up in the middle of the night. Corticosteroids, which are often prescribed to manage inflammation or immune system conditions, are another class of medications that can interfere with sleep. These medications can cause side effects like insomnia, particularly if taken late in the day. For some people, taking these medications can result in difficulty falling asleep, staying asleep, or waking up at night and not being able to fall back asleep. Even medications used for pain relief, such as opioids or non-steroidal anti-inflammatory drugs, NSAIDs, can contribute to disturbed sleep, as they can cause gastrointestinal discomfort or alter normal sleep stages. Moreover, the timing of when medications are taken can also affect sleep patterns. For instance, taking medications that have a stimulating effect too late in the day can cause difficulty falling asleep or staying asleep during the night. On the other hand, medications that have sedative effects, when taken too early, may cause excessive drowsiness and disrupt the body's natural sleep cycle. As we age, the body's ability to metabolize medications can also change, which may increase the likelihood of side effects like disrupted sleep. Older adults may be more sensitive to certain drugs, and even low doses of medication can lead to significant changes in sleep quality. Additionally, the interactions between multiple medications, known as polypharmacy, may increase the risk of side effects, including those that impact sleep. Given that sleep is vital to overall health, it's important to take a proactive approach in managing medications and their potential effects on sleep. If you notice that you are waking up frequently during the night, especially at the same time every night, it's worth reviewing your medication regimen with your healthcare provider. They can help determine if any of the medications you are taking could be contributing to your sleep disturbances and suggest adjustments or alternatives. In some cases, your doctor may recommend changing the timing of when certain medications are taken or switching to a different medication with fewer sleep-related side effects. In conclusion, while medications are essential for managing various health conditions, it's important to recognize their potential impact on sleep. Regularly reviewing your medications with your healthcare provider, discussing any sleep disturbances you experience, and exploring alternative treatments or adjustments can help ensure better sleep quality and overall well-being as you age. By managing your medications properly, you can minimize disruptions to your sleep and improve your ability to stay rested throughout the night. So, what can you do to improve your sleep if you're waking up at 3 a.m.? First, it's crucial to establish a consistent bedtime routine. Our bodies thrive on routine, so try to go to bed and wake up at the same time each day to help regulate your circadian rhythm. This consistency signals to your body that it's time to wind down and time to wake up. Avoid caffeine and heavy meals close to bedtime, as they can interfere with your sleep quality. Caffeine especially can remain in your system for several hours, and may prevent you from falling asleep or cause you to wake up in the middle of the night. It's also helpful to create a relaxing environment before bed. Make your bedroom a calm, quiet space, free from distractions like electronics. The blue light emitted by phones, tablets, or televisions can suppress melatonin production, making it harder for your body to fall asleep. Instead, engage in relaxing activities such as reading a book, practicing deep breathing exercises, or doing gentle stretches. These activities can help signal to your body that it's time to wind down and prepare for rest. In addition to creating a peaceful environment, you might consider incorporating aromatherapy into your routine. Essential oils such as lavender and chamomile have been shown to promote relaxation and improve sleep quality. You could use a diffuser in your bedroom to fill the air with calming scents that help your mind and body relax before sleep. If you find that you're still waking up at 3 a.m., it's essential to address any underlying health conditions. Sleep disturbances could be a sign of conditions like sleep apnea, restless leg syndrome, or even chronic pain. It's important to speak with your doctor about any sleep issues or other health concerns that may be affecting your ability to sleep through the night. They can help identify any underlying causes and suggest appropriate treatments or lifestyle changes to improve your sleep. Additionally, you may want to evaluate your daily habits. Engaging in regular physical activity during the day can promote deeper sleep at night, but make sure to avoid vigorous exercise right before bedtime, as this could actually make it harder to fall asleep. Likewise, managing stress during the day through techniques like mindfulness, yoga, or journaling can help reduce anxiety and promote more restful sleep at night. Remember, waking up at 3 a.m. is a common issue for many older adults, but it doesn't have to disrupt your life. By understanding the potential causes and making a few changes to your routine, you can improve your sleep quality and overall well-being. Good sleep hygiene, including a consistent routine, a relaxing environment, and addressing any health concerns, can all help you sleep more soundly through the night. If you're struggling with sleep, don't hesitate to reach out to your healthcare provider for guidance. They can help you identify the root causes of your sleep issues and recommend treatments or strategies that will help you get the rest you need. Taking proactive steps to address your sleep concerns can lead to better rest and better health as you age. A good night's sleep is essential for maintaining your energy, mood, and overall quality of life, so don't hesitate to prioritize your sleep health.